Hello and welcome to Tapping Tuesday. My name is Fable, and for the next hour, we will be doing EFT together, which is known as Emotional Freedom Techniques, also known as tapping. So, if this is what you're looking for, you found it. If you have no idea what that is, but you are hoping to alleviate some stress, overwhelm, maybe some trauma that's past, present, future, then stick around because this is a method that will be very easy to become familiar with, and then I will be here to guide you. If it is your first time, welcome. If it is not your first time, welcome back. I'm so happy to be here with you, and I hope that you're having a wonderful end of the year. But if you're not, then hopefully that's something that we can address together today. I'm going to give you a quick rundown of how this hour typically goes, and then we'll jump right into the tapping. So it's a little bit different than having a one-on-one session. If you've had an EFT session before, obviously I can't see you, I can't hear you, so I can't read, your body language and whatnot, which is a huge part of what clinical EFT is and really sets it aside from other EFT sessions and meditations, which are all beautiful and valuable. But the reason why clinical EFT is so effective, above and beyond, and reliable is number one, because it's been tested, it's been standardized, but it also includes things outside of just the rote steps of EFT. And that's what we're here to practice. So as we communicate, I will point things out to you so that you can begin to recognize in your own body different signals that are happening. So that as you receive this communication, as you create this bridge with yourself, you have a better and better understanding of what it is that's happening so that you can feel really good about it. Because this is something that I'm really proud of you for engaging, and I really want you to feel positive about it. So we want to take away all of the mystery and help you understand the science behind it and see the building blocks, because they are incremental a lot of times. Sometimes there's a big one, but the incremental steps that happen and to feel that benefit, even if it's not the whole chunk all at once. A couple of things that will be different is the way that I do the tappings on the acupoints. So I tend to stay just on a hand, or I'll go here to the kidney meridian as well. Instead of doing, typically we start here, we do the setup statement, and then we go through the other points. Some people start here, some people start here, and then we go, all over the face and underneath, and then start over again. There are two reasons why it's okay if that's not what's happening. One, all you need is one acupoint. Now, all of them have their own benefits to it, but as far as EFT goes, we're looking for the communication that this inspires with the brain. So the one spot is enough. So if you have a difficulty with reaching the top of your head, or maybe the sides of your body is difficult, it's okay. You're not missing out on a benefit by not being able to access that point. Also, if maybe tapping on your face is a trigger for you, it feels too similar to some trauma that you've had, it's okay for you to skip those spots. We don't want you to push yourself through something because you think you have to have that in order to have your healing. Now, if you can reach a point later on where you can tap on those points, great. You will get additional benefit from it from a Chinese traditional medicine standpoint. But as far as EFT goes, one spot, and that is sufficient. So I tap here or here. The second reason for that is I want you to follow your own cadence. So please do tap on as many spots as as you feel comfortable with, because I want you to learn your own body in that. Because you may come here and go, ooh, oh, this feels like a really important spot. I want to stay here for a while. But then if I continue on, you might feel like, oh no, I'm behind. Am I doing something wrong by not? I don't want you to worry about what I'm doing. So I'm going to be as boring as possible. And I'm here in case you get lost. But otherwise, please listen to your own body on how long to stay on any of the points at any given time and go through the cycle that feels positive and right for you. The way that we do suggestions is very much in the moment. So I have a live chat that's going the entire session. And this is how it works every session. You show up, our community comments on what they want to tap on. If you don't want to comment, that's okay. You'll still get a lot of benefit out of what we do tap on. And I'll give you suggestions on it. You can slightly adjust it if it's something that doesn't really correlate with your life at this time. If you have something that you do want to suggest, but it doesn't feel safe to put it out there in front of everybody on the internet, you can always email me and then I will bring it up the following week anonymously. So that way you can also be included and feel safe. My email is at the top of the chat where it's typed. I will also speak it out loud. It is Fable, FABLE, at EFTuniverse.com. I feel like there's one thing I usually say that I'm leaving out. What is it? It's not coming to me. I'm blinking. So I'll let it ride. If it comes back up, then I'll mention it. That's essentially how we do things here. So I'm going to take a second just to say hi to everybody who's shown up. I will take us through a quick little grounding exercise, and then we'll get right into the tapping. I do have a conversation I've been having. The person didn't necessarily ask for this to be brought up. I'm going to keep it anonymous, but it's something that I feel like is really beneficial for everyone to have. I'm actually going to do it now since it's more of talking than jumping right into tapping. What our conversation is going through is a little bit of, okay, so there's this thing, there's really a lot of big emotions attached to it, some really intense things attached to it, like not feeling safe, like I'm going to be physically attacked, like I'm going to be unalived, sort of a thing. And they can get to a point where, they tap and things release and they feel really good, but then it's triggered again. And it's triggered again. It's like, even though in the moment it releases, it's still like it's not gone. And that's been really frustrating and confusing of, well, if it's healing in some way, then why is it not gone? Why is this part of it still so alive and reactive? And I love this question because I think it's very common for this to happen and can feel discouraging, like you're not doing something right. What I say in this context is, instead of going granular and looking for, like, okay, what aspect, what detail am I not approaching, that's keeping this alive, you're releasing stuff, trust that. Instead, think, okay, what bigger picture am I not addressing in the tapping that I'm doing that is still attached to this outcome that I'm having? So with this person, it's a lot about safety, right? A lot about being targeted. So I would say, instead of focusing on this one aspect with this one person and going, okay, this person makes me feel all of these aspects of fear, going, what do I believe is generally true in my life? That if there's someone that's horrible, they're gonna target me if I'm there, because I draw that kind of attention. Um, the whole world is awful, and anytime I go outside, I'm risking my life. Like, what belief is there that exists in this little area, as well as what is true for me as a whole? And that is generally where, when you've worked on a trigger and you're getting releases, but it keeps coming up, it just means that it's applied more broadly than just where you're tapping. It does not mean that you're doing anything wrong or that you're missing something and you're not being effective. You are. Your brain's just letting you know, hey, it exists in these other pockets as well. Okay. And there's my PSA. Now I'm going to say hi, and then we'll get going. Hi, Mary. My suggestion is fear of being scared. Hey, we just talked about that. Happy New Year to you too. Hi, Mama Hutch. Cold Florida. Oh, hello, Blast Scout. Happy recovery from stress from holidays. Stress about my dog having a procedure at the hospital. Absolutely. Hello, Harmony in Quebec. Hello, Zarina. Feels weird doing this in public. I'm glad to be here. Well, I'm glad you're able to be here. I can understand why that would feel weird in public. Hello, Lou in Ontario. Mama Hush, welcome to the Canadians. I will not complain too much about Florida. Serena, I'm never boring. Thank you. Hi, Nancy. Happy New Year to you too. We like happy. Yay. Lou, it's freezing. I bet literally. I am cold, but it's not freezing where I am, and I am grateful for that. Oh, hi, Lee. Thank you for texting session reminders. Yes, that EFT Universe does that. That's actually, I'm not the person that does that, but I am also very grateful for it. And I set my own reminders in my own phone. So yes, thank you. I will let them know that you appreciate that. I understand how big of a difference that can make. Hello, Joyce. In California, rain is expected. Yay. And let's see, we'll try to send you some sunshine. Um, in Virginia, hello. Also in Florida. And hello, Joyce. Looking forward to a wonderful session. Yay. Alrighty. Feel free anytime if you want to drop more suggestions. It doesn't have to be right at the beginning. Anytime you feel inspired, go ahead and drop them in. And hi, Dr. Scott. Hello. Would you like for me to refer to you? That's what I was trying to say. As Paris. I see Paris Salah. Let me know how would you like for me to address you when you comment. And hello, and Oman. I know about frankincense from Oman, so that's my bit of knowledge that I have about where you are. Zarina, I have 8 alarms going off. That's amazing. And Danielle in Quebec. Thank you for letting me know your name. Alrighty, let's go ahead and, oh, I see Virginia popped up with still working with pain in the lower back, legs, and sciatica pain. Got it. Um, Virginia, this is totally off topic. I'm sorry, everybody. Virginia, do you know about the piriformis muscle? If you do not, I'm curious if you have something. This is from my massage therapy history. You do know about it. Okay. If you know what, email me. If you want to have a conversation about that, email me. I might be able to assist you in a different way with help with that pain. Hi, David in the UK. All right. All right. I'm just going to sit here and chat with you guys the whole time. We need to get to tapping. Let's go ahead and get grounded. Virginia, my email is up at the very top of the chat. If you just scroll up, then you'll see it there. Let's go ahead and take a moment to get grounded and then get on to tapping. Let's see, for grounding today, I think I'm going to follow just what my body started to do naturally. And let's just use the sense of touch to ground ourselves. Now, this may or may not feel entirely safe. There's a lot of people who are overstimulated, overwhelmed, or traumatized by the sense of touch. So, we're going to do this in a very safe way. I want you to know this is going to be a very safe grounding. And could be an easy introduction for you to consciously approach the safety of the sense of touch. Okay, so first we're just going to rub our hands together, and that's all. We're just going to feel the palms of our hands against each other. Maybe your hands are cold, and maybe you're noticing that. Maybe you're noticing they're really nice and moisturized, or you're noticing they're a little bit dry and rough. We're just going to rub them back and forth. Okay. And as we're doing that, I want you to notice your breathing and just set your hands on kind of automatic movement. And notice how your breath is while you're engaging this touch. Notice if your chest feels tight. Notice if you're breathing kind of shallow. Allow yourself to just notice it. We're not changing anything yet. We're just going to let our body get used to the idea. We're just listening and noticing, oh, okay, but nothing's happening other than I'm noticing this touch in my breathing. Let's go ahead and take a deep breath in as much as it feels good to you. So don't force it to be too deep, but go to what feels good and breathe in and out. Okay, now take your hands and move them kind of like you're washing them, maybe. Just include both sides of your hands. And you can do that, in any format, however it feels good to you, to just also touch the backs of your hands. And at whatever speed feels good. And again, we're just touching acknowledging that we're touching our hands, seeing what that feels like, noticing. And notice again your breathing. Did your breathing stay deep? Did it go back tight again? Is it pretty normal for you? What is your breathing like as you're touching both sides of your hands? And as we're touching both sides of our hands, let's take a deep breath. Okay, let's go back to just touching our palms again. Just the inside of our hands. And as we're touching just the insides of our hands together, we're going to notice that we have a body. We're going to notice the rest of our body. And just notice that you have feet, likely two of them. And notice that you have ankles and calves and shins, possibly also some knees, maybe two knees as well. Your thighs, you have some hips, backbone, your spine. You have a waist. You have a rib cage, shoulders, forearms, elbows, biceps. You have a neck. You feel into your ears, even if you can't see them. And all the way to the top of your head. Go ahead and still your hands. Take another deep breath. And let it out. Good job. That way of grounding is an introduction of staying grounded and present with movement. A lot of times when we're taught to be at peace or be present with ourselves, we're taught to do it in a very still environment. And that's great, except typically we aren't very still as a species. So learning how to adopt that safety into movement can be really powerful. So, alrighty, let's see. Let's start with, we've got a physical pain suggestion and fear and being scared, stress from holidays and future stressful events. I think let's start with something really broad, and I'm going to say this big feeling. And wow. First, I'm going to repeat myself multiple times. I am going to make it one emotion. And if you feel like that's not true, that are not best for you right now, go ahead and say these big feelings. But if you can, focus on just one big feeling. And I want you to name it. Let's go ahead and tap while we're talking. Name this big emotion. And it doesn't have to be the biggest one that you're having. It doesn't have to make sense. Maybe you've had a really wonderful time, but you're feeling angry today, or you're grieving today, or, you don't have to have a logical reason for any of it. Just notice that it's there and choose the one that you want to. And you don't have to have any backings for it. Okay. And it could even be a positive emotion. It could be something that you are really enjoying that you have and you want to have more of it. You can choose that for this tap as well. As I allow myself to focus in on this big emotion, I deeply and completely accept myself. As I allow myself to focus in on this big emotion that I feel in my body, I deeply and completely accept myself. as I really focus in with great detail on this big emotion that I feel in my body, I deeply and completely accept myself. This emotion, this big emotion, this big emotion in my body, this big emotion affecting my body, this big emotion in my mind, this big emotion affecting my mind, affecting my thoughts, affecting my mood, affecting my perspective. Even though this big emotion has very big impact on me right now, I deeply and completely accept myself. And I wonder, do I know why? Do I know why this emotion is so big? Do I know why this big emotion is affecting me so much? Yes. No. I don't know. Whether or not I feel like I'm completely certain about where this big emotion comes from, I still choose to deeply and completely accept myself. And I wonder, why why would I spend time thinking about something that's already affecting me so much? Why am I paying more attention to it when it already is taking up so much of my attention in the first place? Why wouldn't I just do everything I could to get rid of it as fast as I can? Even if what I really want is to get rid of it as fast as I can. I give myself permission to take just a tiny bit of time to be curious. And I allow myself to be curious in a way that feels safe, in a way that feels nothing but curious, in a way that does not bring me bigger or more intense feelings. Okay. All right, then. I wonder, what benefit do I have of thinking about this? But really, I'm not saying it as a judgment. If I'm really asking as a curiosity, what benefit could I possibly have if I stop and consider, why is this even here in the first place? Well, hmm, hmm, considering, considering this big emotion. As I consider this big emotion, and why it's in my body and in my mind, I wonder, what does it feel like in my body? How do I know that it's connected? That the way this feels is definitely this emotion. How do I know that? And when I have thoughts, how do I know they're thoughts connected to this big emotion? Does it have its own voice? Does it sound like somebody I know? As I ponder how I've even identified this big emotion, I deeply and completely accept myself. Is it possible that it's familiar in these ways because it's how I've experienced it before? That it shows up for me right now in this particular format because this is how it first showed up for me ever. Maybe a long time ago, way back in my history, way back in my past, I experienced this big emotion for the first time. Okay, that's possible. And I might remember that first time. And I might not remember it at all. But I wonder, was that experience, whenever it was that I first experienced this big emotion, was it the same? Was it the same circumstance that I'm experiencing now? Are the parameters the same? Is my position and my ability? Is all of that the same? Yes. No. I don't know whether or not I know for sure if things are the exact same as I have felt this in the past to how I'm feeling it now. I deeply and completely accept myself. And I wonder, what if it isn't? What if it isn't the same? Isn't it likely that I probably experienced this at a pretty young age? Things are very different now than when I was at that young of an age. But I wonder what's different? Well, I'm an adult now, and that means I have a lot more freedom. I have the opportunity for choice. I likely have more say in what can happen. I possibly have more resources available to me. I can probably set different boundaries. Maybe I can ask more questions. Maybe I can advocate for myself in a different way than I could back then. As I consider these potential differences, as well as others, I deeply and completely accept myself. And I wonder, well, if all of those differences are true, then shouldn't this big emotion also be different? Yes. No. I don't know. What do I mean? Well, sure, it's a factor. And this emotion, even if the emotion itself stays the same, the way that it layers in its effect, well, that's wildly different. So, doesn't that mean I can give myself permission to experience it differently? Maybe it'll still be there. I still have emotions. I still feel affected by things, of course. But maybe, maybe I can let all the parts inside of me know. Let my nervous system know. Let all the memories in my brain know. All the places in my body where I feel it, where this emotion affects me. Let all these parts of me know, hey, yeah, it's there, but it's different now. See? Hmm, that's cool, but what would I show them? These parts of me. How can I show them that it's different? Solid question. Maybe I could show my nervous system that I know how to move to a safe place, whether it's my home, a room, my car, a boundary that I can place in my mind, a place where I give myself permission to construct whatever I need in order to feel safe in my environment. I can do that now. I have that permission. Maybe I am able to speak up in ways that I couldn't before. I can ask questions. I can take time. Maybe I have multiple methods of communication that I can engage. Maybe a long time ago, all I could do was talk or not talk. But now there's texting, there's email, there's phone calls, so many options. I could even send a letter, maybe. It's an option of communication. There are a lot of ways that my life is different now. And it's okay for this big emotion to affect me differently. This big emotion affecting my body. This big emotion affecting my mind. This big emotion. I wonder, what effect do I want it to have? Maybe it serves a purpose, and that's okay. And maybe I just didn't realize I could do this. And I actually can just let it completely go. I don't need it at all. I can completely get rid of it right now because maybe I found other tools, different ways that I can reach the same goal that I have with a different emotion. Maybe this one, it can go to rest. my choices, my emotions, this big emotion, my choices with this big emotion. And as I continue to move forward, doing what I need to do, approaching what I need to approach, I give myself permission to have feelings. Of course, I'm going to have feelings. But I also give myself permission to have the feelings that fit this moment and only this moment. And if I need to go back in my history and resolve things, of course, I can do that when it's appropriate. But I give myself permission, even before I do any of that, to experience emotion in this moment for what fits in this moment. And I allow myself to feel comforted, to feel confident, to feel seen, and to feel supported as I give myself this permission. And I deeply and completely accept myself. Pause and take a deep breath. Now take just a moment and think about how you felt when we started tapping and that big emotion and how that affected you and your body. And notice when you think about it now, if it feels different, if your body feels more distant from it, if it just feels smaller, if it's shifted its definition entirely, is it even there anymore? If during the tapping you were sighing, crying, laughing, yawning, stretching, got excited, had epiphanies, all of those are signs that you communicated with your subconscious brain and it said, ooh, well, I had this old template, but I like what you're laying down better. So yeah, let's adjust to this over here. And it's going to keep that going, even though you're no longer tapping on it. So good job. All righty. Oh, thank you for the comments that you don't have to take time during the taps to put in comments, but I always enjoy it. Please don't do it just because I said that. But I think it's helpful overall when you share your experiences, not just with me, but so everybody knows, because it's a spectrum of experience, and I think it's always helpful to know that um, you're not the only person having whatever experience that it is that's come around for you today. Yay, Blast Scout. Yay, Virginia. Yay, Mama Hutch. Good job. Mm. Okay, and Dr. Scott just said, having some new insomnia issues. Lie down, though my brain gets jacked up. I hear you there. Which there are actually some interesting things I'm looking into in adrenaline triggers that laying flat can initiate. Um, I think that's why I'm feeling what you're describing. I am just going back through. Let's do physical pain or just physical issues next. So, in doing physical issues, if you are blessed enough to have a body that is not speaking of any physical issue at this moment, you can tap on something that can be a physical goal. If you're wanting to gain muscle mass or lower your cholesterol, it doesn't have to be something that you can physically see. It doesn't have to be like, oh, my joint, or, oh, this injury. It can be anything having to do with your physical body. It can also mean emotions that you're feeling in your physical body. If you're thinking, oh, the emotional tap was great, but I've got more, perfect. You can actually address that in this next one as well. So it's all in how you define the prompt that we're using. So when I say physical body, you can take that as anything that you feel affecting you in your body in whatever way that that is. Okay. Um, let's see. We'll go ahead and start tapping while we're talking and thinking about it. I feel like I want to put some parameters around it. So I'm just thinking through. Let's put, because I want to do sort of a perspective shift with the brain. And when we're doing perspective shifts, sometimes it works to do like a large overall physical body. That can be a little bit, just in my own experience as a practitioner, a little bit more complicated to do all at once. If someone's been in pain, especially chronically, for a long time, and then you say, I let it go and it's done, the brain goes, okay, and it doesn't work. But not because you did anything wrong, other than you didn't approach it in a way that the brain could say yes to. So if you just put smaller parameters on it, then a lot of times you can start to switch that no to a yes, because the subconscious brain is very, very stubborn. It is very stuck in the way that it operates. And that's actually a positive thing for us. Um, but that also means that we have to respect that and approach that in a way that we can meet the way that it operates in order to get it to address what we are asking. Okay. It's a relationship. So, as we are considering what we want to address physically, um, let's go for the next 2 days. Let's make that a parameter. So, we're going to adjust it in some way for the next 2 days. Okay. And beyond that, sure, absolutely. But at least for the next 2 days. Okay. And that's kind of our bottom line of what we're hoping for. And as you are getting clarity on this aspect of what you're experiencing in your physical body that you want to adjust, I want you to consider a percentage. I want you to first consider between 0 to 100% how that is sitting with you now in terms of how it's affecting you. And I'm not going to clarify. I want you to do it what makes the most sense to you, whether it's, well, at 100% would be my body's perfect. And so it's affecting me so much that I'm at 40%. So it's kind of like I'm looking at it from this negative standpoint of I need to gain 60%. Or you could look at it from, well, I'm feeling it, you know, it's affecting my body. I would be at 0% affected by it if it just weren't there. So it's there about 30%. If I could get rid of this 30%, then I could drop it down to 0. Whatever way it makes sense in your brain. Okay. So as we are considering the percentage that this is affecting the body to the amount that if it were gone, we would be whole. Okay. I want you to consider of that number that you have, how much of it feels likely that it could actually be let go of for the next 2 days. So, how much of that, just before we even tap on it, feels true to where your body after this tap could say, yeah, sure, I could let that go for 2 days. And you don't have to be super granular about these numbers. We're just getting an assessment. This is just a beginning communication. It's okay for it to, if the number's bouncing around, don't worry about it. If you're like, oh, but how do I justify that number? You don't need to be that specific on it. Okay. We're just starting this conversation and getting the brain focused on these are the things that we're concerned about right now. Okay. All right. Let's do some phrase work. As I consider this aspect of my physical body that's currently affected in a way that I don't want, I deeply and completely accept myself. Even though right now there's this aspect of my physical body that is not ideal and it's not better yet, I still choose to deeply and completely accept myself. Even though right now, what I have done is really focus in on this aspect of my physical body, but it hasn't fixed anything. I still choose to deeply and completely accept myself anyway. My body, my physical body, this negative aspect, this negative aspect of my current physical body. I wonder, does this negative aspect have control over my physical body right now? Yes. No. I don't know. Whether or not I feel confident in my answer about this having control of my physical body, I deeply and completely accept myself. And I wonder, well, what do I mean by control? How would this have control of my body? Is it moving my body without my will? Probably not. But is it sending signals that I don't want to hear? Is it interrupting things that I'm trying to get my body to do? Maybe I do believe that this negative aspect absolutely has some control that I do not currently have over my body. I wonder, is that normal? Is it normal for me to not have control over my body? Yes. No. I don't know. What a weird question. What a very strange question to ask. But I wonder, is it normal for me to not have this control over my body? How much control do I have over my body? Well, typically, I control when I speak, where I look, how my muscles move, when I eat, when I drink. But do I have control over when I feel pain? Do I have control over when I sleep? Do I have control over how I feel after I eat? Hmm. Yes. No. I don't know. Hmm. Okay. Well, I acknowledge that while I do have a lot of control over certain aspects of my body, there are other aspects that I'm generally not aware of at all. I don't know how much stomach acid I have in my stomach. I may or may not be aware of how my stomach's going to feel about the ingredients that I've ingested. I don't know if there's extra bacteria in my stomach right now that's going to make it more difficult to digest things. I don't really have a count of the healthy bacteria I'm supposed to have in my gut. I know it's supposed to be there, but is it there? I don't know. That's not something that my body relays to me. My body. My body relaying things to me. Hmm. Well, I wonder, why doesn't it tell me these things? Why doesn't it tell me how much stomach acid I have? Why doesn't it tell me if I need to take a probiotic? Hmm? I mean, that would be helpful. That would make things go smoother. Why doesn't it tell me what I can or can't do in order to sleep well? I wish it would. As I consider these signals that I do or do not receive from my body, about my body, I deeply and completely accept myself. And I wonder, well, what signals do I receive? I know when I need to go to the bathroom. I understand when I feel thirsty and hungry. But what about this particular experience that I'm focusing on right now? This one thing in my physical body. Is it just a nuisance? Or could it have a purpose? Is there some way that this could be a signal from my body? A signal from my body. Okay, well, if it is a signal, is it whispering? Is it talking? Or is it screaming? Hmm, I wonder if this were a signal from my body, and if it were something that I could recognize, would I take care of it? Yes. No. I don't know. I mean, when I feel my body screaming to go to the bathroom, of course, I take care of that. But maybe sometimes I feel my body screaming for sleep, screaming because it's in pain, or I'm hungry, or I need a break, and I push through. Hmm. And I don't listen. I wonder, Why don't I listen there? Maybe it's because of the immediate consequences. If I don't listen to my body when I need to go to the bathroom, I will probably just end up going to the bathroom when I don't want to. Huh. I wonder, could that be similar to this other experience where perhaps I've just been able to not address it enough that I'm having a consequence now? Ugh, I don't want to think about it that way. I don't have time to deal with another thing. Even if, as I consider this, it just feels like another task and more work and not a solution yet, I still choose to deeply and completely accept myself. And I wonder, okay, how could I make it a solution? Is there an easy way for me to have my body be happy, have my body function, and it not have to be this huge overtaking? Well, what if I make a deal with my body? Could that work? Maybe that could work. Maybe I'll give it a try. But what kind of deal? Maybe I can say, body, I know. Maybe I'm aware of how I have not done well with this. And maybe I'm still not quite sure. But I do know screaming is not helping. But I am looking for a way to help. So, body, what if? What if right now we start over? And this one aspect, this one thing, not everything, just this thing. And body, your part is you allow relief. You stop screaming. You trust me. You trust that if you get quiet on this, I won't just ignore it. And body, my part is that for the next 2 days, I will listen. When I hear you whisper, I will comply. And if I'm in a place where I can't immediately comply, I will communicate with you. And I will say, hey, body, I'm noticing this. And I can't give you exactly what you want, but I'll get as close as I can until I can do that. My body. This issue in my body. Connecting with my body. Offering trust. Asking for trust. Looking for solutions. Starting in a new place. Starting over. And as I offer this message to my body, I give myself permission to receive the answer. And it's possible my body will Allow all of the signal to cease, and I will feel 100% relief. And it's possible that it will be somewhere between where it was and where it could be. But wherever it is, I hold space to maintain my part of the bargain, to allow myself to communicate with my body about this one thing for the next 2 days and see what happens from there. Because isn't it true that if this works, it could be the fastest, easiest, most simple solution that could also provide a safer place for me and my body. Me and my body. A safer place, a happier place. Collaboration. 2 days. And as I allow this to begin, I deeply and completely accept myself. Okay, pause on your tapping and take a breath in. And notice, how does your body feel? Now, one aspect that you were focused on, how did it feel before we started tapping? And what was your belief on how much it could shift to how does it feel now? And did it shift to your expectations? Is it greater? Is it lesser? All of these are good answers because all of it means that you did reach that point of communication with your brain. And if you were relaxing, sighing, crying, deep breathing, if you feel sleepy now, if your body feels kind of buzzy, if you feel a little bit kind of foggy headed almost, a lot of those, or all of those, are signs that your brain heard what you were talking about and is adjusting things in real time, and it will continue to do so, even though you're not tapping on it anymore. So, congratulations, good job. And remember to take this in gosh, my brain is saying the funniest words for this. I was going to say inedible steps, digestible. That's the word I was looking for. Digestible steps. That moving forward does not have to be, oh my gosh, I have to create this miracle now in 48 hours. No, 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 no. Your goal is to listen to your body for 48 hours. That's all. And if that means you get up and go to the bathroom half an hour before you would have last time, great. That's progress. We're looking for long-term solutions here. So don't make it super drastic. Just allow yourself to be really excited to have this new space to start over with your body. Alrighty, thank you for sticking with me for the few minutes that we went over. I hope that you've had a wonderful week, and I hope that you have a wonderful week this next week. I will post a video on Friday or sometime over the weekend based off of our conversations. If you have anything that you want to suggest, you're always welcome to email me or post on any of the videos that we have. I'm the one who answers those, so I do see them, and I do my very best to keep up with them. I hope that you feel better. I hope that you feel cared for and listened to and appreciated because you are. We love you, and I'll be thinking about you. And I hope I get to see you next Tuesday. But if not, there will always be a recording posted, and I'll be happy to see you when you can come back. So take care and mwah, mwah, mwah. Happy New Year, and I'll see you soon.